Hello and welcome to All Things Career Services. I'm Dr. Tracy Spotts, and unfortunately my partner in crime, Tatiana, is a little bit under the weather, so you will have to just deal with me today. But I am super excited about our show. We have my sister from another Mr., Mabry, here on the horn, and she's going to talk to us a little bit about our CDL program and about healthcare. So, Mara, why don't you tell us what you do here at the college?
Thank you, Tracy. My name is Mara Mabry. I'm the Associate Dean of Workforce Solutions. So basically, in our department, we work directly with business and industry and customize classes for them in every kind of different area. So we're going to talk about CDL and healthcare today, but also I deal with manufacturing, distilleries, all kinds of different businesses.
So you're one busy lady. Is that what you're trying to tell me?
Yes. Very.
Okay. All right. Awesome. So let's just go ahead and get this party started. Can you tell me a little bit about the BCTC CDL program and what certification you get?
Yes. So the CDL program is one of the things that we focus on in workforce is short-term credentials to get the students and people into the workforce immediately. And so the CDL program is a 4-week program, and you would get your CDL-A certification. The great thing that I think about that distinguishes BCTC from other CDL programs is we teach only for on double clutch. And so that way, when they go to get tested, they are certified for everything. So automatics, any kind of truck basically, which is really great. And it helps them get directly into the workforce. And then also, we do offer a hazmat endorsement as well at the end, which also makes you, more workforce ready. And the staff here, we have a project coordinator, and she basically walks the student through everything, every step, because there's a few things you have to do to get prepared for the class. Get your permit. There's like a medical, background check and all that kind of thing. And she just walks you through every step to make sure she gets you to the class first day.
Oh, very neat. So what does a typical class look like schedule-wise?
So the first few days are sort of centered around J.J. Keller, and it's like an online program. And I believe there's like 43 online modules. And you come to class, the instructors are here. They, make sure that you don't have any trouble with it. And it really helps you get more familiar with the class, the truck, procedures, all that good stuff. So that's combined with just regular instruction. So the instructors also go over like safety features and different things that help you be more successful on the road. And then we also have a simulator here at BCTC. And so that allows you to be able to touch the clutches and to do all the things you need to do without, be comfortable before you get actually on the truck. And then after that, you would typically go out into what we call the yard and basically learn different maneuvers. So you'll get in the truck and learn how to turn, learn how to parallel park, just different basic maneuvers. And then the last 2.5 to 3 weeks is basically centered around just being on the road like 200 miles a day and they just take turns. And then they will have to sort of be like, okay, this is why you don't do this, or this is why we did this, to make sure that the student understands completely and can pass their exam at the end.
So it sounds like you know a lot about this program. Do you have your CDL license?
No, I do not. But I am assured that they're going to teach me how to parallel park that bad boy eventually. So.
Okay, will you tell me that day? Because I definitely want to be a fly on the wall when that happens.
Definitely.
All right, so can you tell me what is your pass rate for the CDL program?
I'm very proud to say that BCTC CDL program has a 100% pass rate. Our instructors are very passionate about student success and safety, and they go over the pre-trip very thoroughly because that's a very important part of the exam, and they just really are concerned about safety. So we have had a 100% success rate with pass rate.
That's incredible. At my previous institution, they wanted me to get my CDL so I could drive a big bus to take students to events. I couldn't even make it past the inspection. So I understand. So I know firsthand how impressive it is that BCTC has a 100% pass rate.
And that you can be a passenger when I learn how to parallel.
Oh my God. I'm going to wear my helmet and my padded suit. All right. Typically, what industries have you seen your students going to work in?
That's the beauty of a career, a CDL. Our students can pursue so many different avenues. It isn't limited to just an over-the-road truck driver. We have had students go with different concrete companies. We have equine transport. We have local and regional. We have hazmat truckers, flatbed truckers. So it's been very interesting to hear about, all the different avenues they've gone in. And then also we've started to have recruiters that come to class as well, which is also a good way for them to get employed as well. But and those industries are all different too. So they've been pulling people left and right, which is nice.
That's awesome.
Yeah.
So inquiring minds want to know, are there scholarships available?
Yes. So you guys may be familiar with the Work Ready Scholarship, and it applies to different various academics. With the CDL, it also applies. Work Ready Scholarship does apply, but it covers about a fourth of the tuition. Just because it's only 4 weeks and it's not like a full long-term program. Mm-hmm. But we want to make sure that our students are successful. So we're constantly looking for different partnerships with the community to be able to offer a gap funding. And so we partner with Kentucky Career Center, vocational rehabilitation, Earn and Learn. So we've partnered with multiple people, and then if you're a veteran, we have services that can, supplement the income for that as well. And just one thing I just want to share too. So going along with our community partners. So last summer we partnered with the Kentucky Career Center, and they wanted to offer CDL to Estill County. And so we actually brought the truck to Estill County so that transportation was not an issue. And we offered it, and then they funded the project. And it was a very successful partnership. And so this summer, we're merging together again. So I'm really excited we're going to be able to bring our CDL program to Estill County again this summer.
So we've talked about scholarships. Is the program affordable? So how much does it cost to do our CDL program?
It costs $5,000 for the full thing. So typically, Work Ready Scholarship takes about $1,222 off that, and it leaves about $3,778. And so that's why it's been very crucial to have the partnerships with our community partners.
That's awesome.
Yeah.
All right, so I have one more question related to CDL. So what funding can you offer to businesses to both encourage the upscaling of their current employees as well as recruit new employees?
So Trains has been a game changer. Trains doesn't stand for anything.
Okay, I was about to ask, what does Trains mean? Like choo-choo? Like, what are we talking about here?
No, so basically it's like a state grant that we are very fortunate to have at BCTC, and it basically covers 75% of tuition. So we knew that it went towards healthcare. We knew that it went towards manufacturing. We knew it went through, towards distilleries and different things. But I was able to find out last year that it also applies to CDL, which has been humongous because now the companies are paying us $1,750 to send their students to us one by one instead of $5,000. And so they're upskilling their employees. It's been a great way to recruit. Like I said, they're coming to us to recruit, students. Mm-hmm. So it's been a real game changer on the tuition funding piece.
That's awesome.
Yeah.
So is there any last bit of information we should know about CDL before we switch gears and talk about healthcare, or do you think that's pretty much it?
No, that's pretty much it. I would say, anything that you're interested in, you can always reach out to me directly. It's Mara, Mara.Mabry, Maybry at kctcs.edu.
Perfect. I was going to ask you for your contact information at the end, so you beat me to it.
Yeah.
All right, so let's switch gears. Another one of your extremely important areas that you oversee. So can you tell us what's another area in workforce that's really trending?
Healthcare is just exploded. Manufacturing used to be our number one, and healthcare is either dead even or surpassed it. It's been amazing because there's such a need for healthcare workers. And so it's been really great to build the relationships with the different healthcare partners like hospitals, nursing homes, and different things, and really help them get geared up with workforce staff.
So you mentioned Trains funding just a second ago. So does Trains funding work for healthcare as well?
It does. And the trend that we're starting to see with the healthcare partners is because of being able to get the 75% off. I'm seeing some, upskilling of, current workers, like they're taking people in food service and just, different areas of the hospital and the nursing homes and putting them into like these short-term credentials. Like I said, workforce really focuses primarily on short-term credentials. And so, but then they're also using it as a recruitment tool. So a lot of times our healthcare project manager will send out like the link to these open positions at the different hospitals and have, our students apply for it, or, whoever's interested. And then they'll have like the hospital or the nursing home. They will be the ones that are actually interviewing and vetting these. Because we're not going to hire them, obviously, but we're trying to get their foot in the door. Mm-hmm. And so they will get, interviewed and everything like that, and be able to go. And here's the really big piece I feel like that's on top of it being a game changer of like now they're providing jobs, they're recruiting, they're upskilling their employees. But when they sign up for a class, like so basically I would customize a class, and I'm sure we'll go over the different types of classes later, and that we primarily focus on. But when we put together a class for them, obviously there's books involved. There's they have to have an exam at the end. There is malpractice insurance, and of course the class itself, and trains cover 75% of all that. And then there's also supplies are not included, but the hospital nursing home pay for that. So here's this person that wants to be employed. So now they're employed. They're getting their class, their books, their supplies, their exam, everything for free on top of it all. And they've got it, they're employed and they're able, and once your foot's in the door, a lot of times the sky's the limit. I really wish when I was growing up that I would have had an opportunity like that. I think that would have been, really great to be able to work through college and just to be able to start your career early.
That's true. So what are the top areas that tend to be heaviest recruited?
We started out pretty much in workforce with nurse aide. It's a 6-week class, and then there's there's like 2 days of clinicals within the week 7, and week 8 you take your exam and you're done. And so that's primarily, we have some healthcare institutions that every 2 months we're partnering together and we're customizing a class for them and just for their employees and just from their recruiting efforts. And then that's trended. So we have like a lot of healthcare partners that we offer nurse aid to. That's like an ongoing thing. I guess 2 years ago, I started the Central Sterile Program, and we have started that with one institution, and that's basically where it's the sterilization of the operating equipment.
Oh, okay.
And that's a 16-week program, and you have to get 400 clinical hours in there. So we have it designed to where at the end of the 16 weeks, you've got all your hours in, and you go for your exam. I think that's going to start taking off very shortly. Another huge one that we have is the Kentucky Medication Aid, and that allows employees to administer medications within long-term care facilities. And so that course is about 8 weeks as well. And we're trying right now to get our KMA2, which is like the next level. So we're going to be up and running with that very soon, hopefully. And I see that really taking off because we've been hearing from our partners that there's a real need, to administer insulin and different things like that you can't do with just a regular KMA. So we're really trying to get the KMA2 going. And then last year, I started the medical assisting program, and we've worked with a few different employers for that. That's a big deal because normally it's a 1.5-year program. So usually we do short-term credentials. It's sort of like a switch. And because of our wonderful academic partners here at BCTC, we were able to condense it into a year. So they can start in January and finish in December and get an entire, and within that, they get their diploma and they get 4 certificates embedded within that.
Wow.
So it's a really big deal. And then there's only like 2 or 3 classes left, and they would actually have an associate's. And so some of our students that have, started their college career, but maybe didn't go anywhere with it, they may have those 2 or 3 classes, and they've been graduating with an associate's, a diploma, and 4 certificates. So,
wow. That sounds so incredible. So that's all the questions I have for you. Are there any last bit of tips, tricks, notes, anything you want to say about healthcare or CDL before I let you go for the day?
No, but I'd say if you're on the fence and you have any questions about, like, can I do this? What would it look like? Who should I contact to have more information? Please reach out to me. Like I said, mara.mabry@kctcs.edu, and I'll be more than happy to get you connected with the right people.
All right, you heard it here first. CDL and healthcare, that's where it's at. Thank you so much, and we will see you again in a couple of weeks.